Each year, breast cancer is newly diagnosed in more than 1 million women worldwide, and more than 400,000 women will die from it. Every woman has a 12% chance of developing invasive breast cancer at some point. In fact, of all the women you know, 1 in 8 will contract some form of breast cancer in her lifetime. Early detection is still the cornerstone of successful breast cancer treatment. Breast cancers that are caught while in the earliest stages have a near 100% survival rate. However, after 9 mammograms, the risk of receiving a false positive result is over 43%. On average, breast tumors are thought to double in volume every 130 days. Some take less time, and many take much longer, especially in older women. Tumors found in women under 40 grow the fastest, and are also the hardest to detect. The average tumor is almost 4 centimeters by the time it is surgically removed, and it's been growing for at least 12 years. At around 11 years old and 1 centimeter in diameter, or about the size of a pea, it's possible to feel the tumor as a lump during a breast exam. At their most sensitive, an expert mammographer can begin to identify tumors a little less than 0.2 centimeters in size and correctly identify cancer about 78% of the time. But this number drops drastically for younger women with denser breast tissue, to the point where mammograms for women under 40 are considered basically ineffective. An MRI can sometimes detect certain kinds of tumors at even smaller sizes, but this kind of screening is invasive and expensive, and usually only used to supplement a mammogram. But long before a tumor even exists, an average of 3 years after the first cancer gene mutation occurs, there are already over 10 million cancer cells present in the body. To support the growth of these cells, the body builds new abnormal blood vessels. The constant blood flow creates a distinct heat signature within the tumor, a small temperature variation that is detectable many years before a tumor is visible to a traditional mammogram or MRI. Over the 10-year period from 1990 to 2000, the U.S. alone spent an estimated $166 billion on breast cancer screening. The average mammogram costs between $150 and $300, and are truly only effective for a relatively small window in the cancer growth timeline. Introducing the First Warning System. First Warning's patented sensor detection technology builds on over 20 years of breast cancer research and testing to provide a completely painless, non-invasive, highly accurate method of early breast tissue abnormality screening. And it's as easy as wearing a sports bra. Normal body temperature fluctuates throughout the day and may vary from person to person due to hormones, fitness level, and even age. For this reason, the First Warning sensors must maintain close contact with the body throughout the testing period in order to detect the minute temperature difference that could indicate a tissue abnormality. The data the sensors collect is then uploaded to the internet, where it's analyzed by sophisticated algorithms. The results are displayed to the user on a personal computer or mobile device. 3 clinical trials have shown the First Warning system has provided a 90% or higher level of accuracy in women of all ages, both in correctly predicting tissue abnormalities and in reducing false positives. Not only is this system more accurate than a mammogram as a screening tool, but it's more affordable, more convenient, and can lead to early detection as a reality for every woman, regardless of age or risk factors. Learn more at firstwarningsystems.com.